गुड मॉर्निंग डैलस, गुड इवनिंग इंडिया, गुड इवनिंग अपना बैंगलोर बोलते हुए आप सबको हर इतवार को जैसे मैं स्वागत करता हूं, आज भी स्वागत कर रहा हूं भारत अन्वेषण कार्यक्रम में। मार्च 24 2024 ऑलरेडी 3 महीने इस साल के गुजर गए हैं। कैसे बीत गए हमको पता नहीं है, फिर भी ये तो वक्त जैसे निकलता रहता है, वो हम वक्त के साथ जाना हमको बहुत ज़रूरी है। चलिए, आज हमारे बीच बहुत ही एक स्पेशल गेस्ट है जो ऑलरेडी आपको पता है कौन है, क्योंकि हर वीक हम जो पोस्टर में भी डालते हैं उनके बारे में, और यूट्यूब लिंक में भी, डिस्क्रिप्शन में भी उनके बारे में डाला हुआ है। ज़्यादा समय नहीं लेते हुए आप सबका आज का कार्यक्रम शुरू करते हैं गणेश वंदना के साथ। चलिए।
गणनायकाय गणदैवताय गणाध्यक्षाय धीमहि गुणशरीराय गुणमण्डिताय गुणेशानाय धीमहि गुणातीताय गुणाधीशाय गुणप्रविष्टाय धीमहि एकदन्ताय वक्रतुण्डाय गौरीतनयाय धीमहि गजेशानाय भालचन्द्राय श्रीगणेशाय धीमहि एकदन्ताय वक्रतुण्डाय गौरीतनयाय धीमहि गजेशानाय भालचन्द्राय श्रीगणेशाय धीमहि। गानचतुराय गानप्राणाय गानान्तरात्मने गानोत्सुकाय गानमत्ताय गानोत्सुकमनसे गुरुपूजिताय गुरुदैवताय गुरुकुलस्थायिने गुरुविक्रमाय गुह्यप्रवराय गुरवे गुणगुरवे गुरुदैत्यकलक्षेत्रे गुरुधर्म सदाराध्याय गुरुपुत्र परित्रात्रे गुरुपाखण्ड खण्डकाय गीतसाराय गीततत्त्वाय गीतगोत्राय धीमहि गूढगुल्फाय गन्धमत्ताय गोजयप्रदाय धीमहि गुणातीताय गुणाधीशाय गुणप्रविष्टाय धीमहि एकदन्ताय वक्रतुण्डाय गौरीतनयाय धीमहि गजेशानाय भालचन्द्राय श्रीगणेशाय धीमहि एकदन्ताय वक्रतुण्डाय गौरीतनयाय धीमहि गजेशानाय भालचन्द्राय श्रीगणेशाय धीमहि।
नमस्कार सभी दर्शकों को राजीव कुलकर्णी का प्यार भरा स्वागत करता हुआ भारत अन्वेषण कार्यक्रम में। आज का दिन है मार्च 24 2024। सबसे पहले सब दर्शकों को बहुत 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 धन्यवाद बोलना चाहता हूँ एंड थैंक यू सो वेरी मच फॉर वाचिंग आवर शो एवरी वीक। आपका ये 1 घंटा बहुत ही मायने रखता है हमारे गेस्ट के लिए भी और हमें भी। एंड थैंक यू वेरी मच फॉर सब्सक्राइबिंग एंड मेकिंग द चैनल सो सक्सेसफुल एंड increasing the subscription, क्योंकि the more the subscriber the more the viewership, which is definitely very healthy for our guests who come on our live shows. Bharat Anveshan, in Explore India is mainly meant to bring unique personalities on this platform so that people can get lot of information about various things. सिर्फ मेडिकल नहीं, सिर्फ NGOs नहीं, सिर्फ म्यूजिक नहीं. There are like so many information that people get from this platform, and our our idea is to bring people and serve the community, and it is definitely a community service, I would say. And thank you all for that, and definitely thank you very much Sandeep Sadanandappa for always being a support on the technical side of it, and he is my backbone for both my shows every Sunday, and thank you so very much. A&V Perspective, and they are master in giving all the audio and visuals, etc. So come on, let's start today's program. Small brief introduction about our guest. She is a senior consultant obstetrician and gynecologist in Cloud9 Hospital in Bangalore, women health activist and popular speaker in school, college and corporate programs. Special interest in maternal medicine, obstetric, critical care, patient safety, adolescent health, menopause care and medical education. Director for Public Image in Rotary Club, awarded Karnataka Women Achievers Award for Medical Excellence in 2023, Rising Star, Times of India, Inspiring Gynecologist of South India, Star Rotarian of the Year, author of the book 9 Months, A Journey of a Lifetime. That definitely calls an attention because it is a very interesting book. One should definitely get hold of that, and we can know more about that from the guest itself about that book. And then author of Growing Up Right, avid writer and contributor to magazines, newspaper and blogs. Invigilator and faculty for MRCOG examinations and training, trainer and faculty for simulation courses like advanced skills and drills in obstetrics. Reviewer of journals, British Journal of Obstetrics and Gynecology, that is BJOG, and International Journal of Obstetrics and Gynecology. That is becoming a little challenging for me every time I pronounce that. Several presentations at national and international conferences, several publications in peer-reviewed journals. Hobbies: running, classical Carnatic music, poetry, writing, art, and gardening. Ladies and gentlemen, let's put our hands together to Dr. Aruna Muralidhar. Aruna ji, welcome to Bharat Anveshan. Good evening. How are you, ma'am?
Good evening, Rajiv ji. It's really an honor and a privilege to be a part of this program this evening and morning for you. And thanks very much for all the viewers. I think you're doing an amazing job. This is community service, bringing all the information from the horse's mouth out there for people to be able to understand the nitty-gritties and not get too diverted by Google Guru. So I think this is a great community service, and kudos to you.
Yes, thank you. Thank you very much for those kind words and nice words, Aruna ji. And before that, I want to let the audience know that today's topic is what is cervical or cervical cancer. Pronunciation can be different in different regions. Some people call it a cervical, some people call it a cervical. So I will go with cervical because that's how I pronounce. And the cervical cancer, what it is, and what are the remedies, and what are the symptoms? Is it curable? These are the questions which are always there in our audience mind in today's world, and it is a growing concern, I would say. And but we have a Dr. Aruna here who is specialized in these particular subject, and definitely we will have a very beautiful show talking to her on a live chat today. So Arunaji, first of all, quickly, originally where are you from? How many years you have been in Bangalore?
I'm a second generation Bangalorean, and I've been here since nearly from birth. My parents hail from Andhra Pradesh, but as I said, I'm a second generation Bangalorean, and I would like to identify myself as a true Bangalorean. So
Oh, nice, nice. And
that's
why
my
did you choose the medical profession? Why not something else, engineering or anything else?
right. Yeah. I think that was a big transformation which happened when I was about 16, 17. I think a little bit of it was influenced by my father's in ill health, but more so from a logo that I read on a St. John's hospital ambulance, which said, "He shall live because of me." So that
Wow.
really swayed me. And I thought, this is a noble profession and I must pursue it. So although I was actually preparing for engineering, I something went through my mind when I was 16, 17 during those vulnerable years, and I turned out to be a doctor.
Wow, that's
No
a
regrets at
wonderful
all. I enjoy my profession and am passionate about it.
yeah, that's a wonderful transformation, I would say. And thanks to St. John's, I can say that because now you are able to provide service to the society. You are a Rotarian as well, and by your profession also, you do the noble, uh, service to the society. How is the feeling?
Yeah, sorry, the background aeroplane training is going on, so I'm not sure if that's audible, but yeah. Um, no, I think definitely. I mean, a doctor's profession is a community service at the end of the day. I meet so many women of all ages, from adolescents, 9 year onwards to menopause and beyond. And every woman comes with a story. Every woman has something hidden which she would like to share with me. And I would love to be that, that voice who can nudge her along. So it is community service day in and day out, bringing new life into the world, performing surgeries and getting rid of their ailments, everything. I mean, that's why I said I'm really passionate about education, educating the public, and women who come to me and looking after them. So
Wow,
Rotarian
excellent.
also serves the purpose. So I think both of them go hand in glove. Yeah.
Absolutely, absolutely. So now today's topic, we are more focused on the cervical or the cervical cancer. So what is actually cervical cancer or cervical cancer as it is?
Yes, Rajivji, though, sir, you're right, cervical in US and cervical in India and UK maybe, but ultimately it is cervix cancer, and cervix is part of the uterus, that is the woman's womb. So it's the neck of the womb, or the mouth of the womb, which is in the lower part of the uterus, which is actually the doorway for the
Hmm.
menstrual blood to come out, and that's the doorway for the baby to come out as well. So that is what is the cervix. So it's still a part of the uterus. And cervical cancer is cancer cells originating in the cervix. And the difference between cervix and uterus is the way the cells are. Cervical cells are different from the uterine cells. So uterine cancer or endometrial cancer is different from cervical cancer because of the difference in cells. So that is what it is.
So basically, what are the symptoms that one should be looking, or maybe alert to be, that way, they could recognize that, okay, probably
True.
this is what it's happening to me.
That's right. Yeah. Um, Symptoms are one way of looking at it. But if one waits for the symptoms, it becomes more of the disease has already set in kind of a situation.
Hmm.
So it's always better to think about prevention, and early detection. So screening is what is more important. But having said that, the symptoms are more late. So they are in more advanced stages that women start seeing the symptoms. So earlier stages, there may not be any symptoms, to be honest.
Oh.
So we look at, yes, absolutely. So when we look at some of the symptoms which happen much later, is, bleeding, unscheduled bleeding between her periods, bleeding after
Hmm.
sexual intercourse, foul smelling discharge, plenty of vaginal discharge, which may be a little bit foul smelling or an altered color, pelvic pain, sort of pain during urination or pelvic pain, pain during sex as well. And if it's really advanced, then she may even have bone pains, etc. If they're, sort of advanced cancer. So these are the, sort of symptoms that one needs to be looking out for. But again, these are all very late symptoms, which occur much later. So I think we would really like to focus on screening, primary, secondary, and tertiary prevention, rather than waiting for the symptoms to happen.
Okay, so is it as you said, early symptoms are very hard to find, and
Yes.
it is like more on the later side. So does it relate to the age by any chance? At what age this can occur or something like that?
Yeah. So cervical cancer is basically a cancer which is caused by a virus.
Oh,
Now,
okay.
I have to say this because ultimately everything is sort of revolving around how this virus affects the cells.
Hmm.
So this virus is called human papilloma virus, or HPV. And
HPV. Okay.
HPV virus is there prevalent in almost everybody. Like, if you take a population, at some point of time, HPV infection may be there because ultimately it's a sexually transmitted infection.
Oh, okay.
HPV virus causes 99.99% of cervical cancers are caused by the HPV virus. So when you look at all the cancers, say lung cancer or bone cancer or blood cancer, they are not virus related at all. They are just environment, lifestyle, or some other mutation, etc. Whereas cervical cancer, along with a few other genital cancers, are related to the HPV virus. And because it's an infection related cancer, there is enough prevention for it. So
Okay.
that is why. And then what happens is when you ask about the age, first of all, the HPV virus, we all have immunity, or rather enough immune system to get rid of the HPV virus. Even cancer for that matter, any cancer, our our immune system is actually fighting the cancer cells. So all of us do not, God forbid, land up with cancer. But those who have a lower immunity, then that's when they're more likely to develop the cancer. So HPV virus initially just gets into the cells, it incorporates itself into the cells, and then slowly starts causing cellular changes, which can be
Oh,
picked up by screening. Those cellular changes become more and more and more severe, and then ultimately cause cancer in 5, 10, 15, 20 years time. But having said that, cervical cancer is a cancer of a younger age group, not like endometrial cancer or ovarian cancer, which is more in 60s and 70s. Whereas cervical cancer at a younger age group, like 30s, 40s, 50s. Hence, it is more important to screen women as soon as they are sexually active, from about 25 years to 65 years. And
okay.
this screening is very, very important, which I will talk.
Yeah,
Yeah.
we'll talk about it. So, what are the risk factors here? Of course, the cancer word itself is very deadly word. Anybody, 50% people, moral gets down. They start getting into depression and so on and so forth. Even at what stage, also, if they are in. So basically, a risk is a risk. I mean, cancer is a risk always because it's the spreading of the cells, as you rightly mentioned. So, still coming back to cervical, cancer. What kind of risk factors involved there?
Yes. Um, Once again, because it's a sexually transmitted virus that causes cervical cancer, those who are, sort of, let's say, promiscuous, having multiple sexual partners, those who have very poor hygiene, like, general hygiene and especially genital hygiene, those who are smokers, and those
Oh,
who have a low immunity otherwise, those who have obesity and lifestyle, being poor otherwise, they are not able to fight the HPV virus. And those who are obviously not vaccinated against HPV, which is again a very important prevention strategy, which I'll talk about. So
okay.
these are the risk factors that we're looking at. Smokers, definitely promiscuous women, those who are not using protection, barrier protection during sex, these are the kinds of risk factors that exist for cervical cancer.
Very beautiful, beautifully explained and beautifully answered, Arunaji. So let's take a quick break and we'll come back on the prevention, and also we will also come on, what are the different stages and other factors, because there's a lot of questions people have sent to me, and definitely we'll talk about that. Let's take a quick break and come back.
किसी राह में किसी मोड़ पर किसी राह में किसी मोड़ पर कहीं चल न देना तू छोड़ कर मेरे हम सफर मेरे हम सफर मेरे हम सफर मेरे हम सफर
किसी हाल में किसी बात पर कहीं चल न देना तू छोड़ कर मेरे हम सफर मेरे हम सफर मेरे हम सफर मेरे हम सफर
मेरा दिल कहे कहीं ये न हो मेरा दिल कहे कहीं ये न हो नहीं ये न हो नहीं ये न हो किसी रोज तुझसे बिछड़ के मैं तुझे ढूंढती फिरूं दर बदर मेरे हम सफर मेरे हम सफर मेरे हम सफर मेरे हम सफर
तेरा रंग साया बहार का तेरा रंग साया बहार का तेरा रूप आईना प्यार का तुझे नजर में छुपा लूं मैं तुझे लग न जाए कहीं नजर मेरे हम सफर मेरे हम सफर मेरे हम सफर मेरे हम सफर
तेरा साथ है तो है जिंदगी तेरा साथ है तो है जिंदगी
तेरा प्यार है तो है रोशनी तेरा प्यार है तो है रोशनी
कहाँ दिन ये ढल जाए क्या पता
कहाँ रात हो जाए क्या खबर मेरे हम सफर मेरे हम सफर मेरे हम सफर मेरे हम सफर
नमस्कार सभी दर्शकों को राजीव कुलकर्णी का प्यार भरा और एक बार स्वागत करता हुआ भारत अन्वेषण कार्यक्रम में। अभी अभी आपने एक छोटा सा ब्रेक में बहुत ही सुंदर सा गीत सुना मुकेश और लता जी की आवाज़ में। आज हमारे बीच डॉक्टर अरुणा मुरलीधर जी जो है बेंगलोर से है। शी इज़ टॉकिंग अबाउट सर्वाइकल और सर्विकल कैंसर के बारे में, वो सिम्टम्स क्या होते हैं, रिस्क फैक्टर्स क्या होते हैं, एंड देन व्हाट आर द रेमेडीज एंड व्हाट आर द प्रिकॉशंस, एंड इसके बारे में अभी हम बात करेंगे। वेलकम बैक अरुणा जी आफ्टर दिस स्मॉल ब्रेक, एंड we spoke about the early symptoms may not be there, but at certain age because it gets transmitted through the cells, and it's a transmitting disease, and because of that it's very hard to find the symptoms at an early stage, but it occurs at a later stage. And also you said that it can be between anywhere between 25 years to 65 years of age that can happen. So now you mentioned about the risk factor, and before we get on to the remedies, how long a person can live after being diagnosed with the cervical cancer? If
Right. Yes, I think whenever it comes to cancer, survival rates are important to talk about.
yeah,
Once again, because as you know, cancer, as we know, it comes in different sort of stages of advance, right?
correct.
So the earlier it's picked up, the more the survival rate. So, for example, stage 1 or 1A, 1B, etc., have nearly 90 to 95% survival rate. So it can be completely cleared. Whereas somebody who comes in stage 4, metastatic disease, where already the cancer cells have spread from the cervix through the blood to the bone to the lungs, etc., then of course the survival will be very, very poor. So it's very important to identify early. And as I said, the age group of cervical cancer is younger than endometrial and ovarian. Hence, the screening has to be done between 25 to 65 on a regular basis, so that we pick up precancerous cells.
So when you say regular basis, means at what interval?
Yes. So as I said, Rajiv ji, earlier, primary prevention, secondary prevention, and tertiary prevention. When we're talking about screening, we're talking about secondary prevention. We have not stopped the virus cells from coming in, but we are trying to understand whether the virus has already caused cellular changes. So that is why we have to do what we call pap smear. Every woman from 25 to 65 should have a pap smear, which is a very simple internal examination where the gynecologist or whoever is a health practitioner will put in a small little instrument into the neck of the into the internal part of the woman in the vagina, have a look at the cervix. So it's an internal examination, slightly uncomfortable but definitely not painful. Very quick test. And once we visualize the cervix from down below, all we need to do is take a tiny little brush and sweep it against the neck of the womb, which is completely painless. And those cells are taken in a little small liquid solution or on a glass slide and goes to the lab for the pathologist to report. So the pathologist looks under the microscope, has a look at the cells, and says whether it's completely normal or whether there are any changes. Again, the changes can be at various degrees. So this is pap smear, the report comes within 2-3 days. And a woman from 25 to 65 after first sexual debut must get it done every 3 years or at least every 5 years. In the US, where you live, the health system makes a woman do a pap smear every year. So it's an annual check. Whereas in the UK and India, we just do it once in 3 years. So that is a beautiful way of figuring out whether there's already some changes happening much before cancer starts happening. So this picks up precancerous cells. That means it's not cancer. It is pre-cancer. If not treated, it may become cancer. So that is the beauty of it. That's the beauty of screening.
So that is the secondary screening you're saying?
Secondary prevention, yes.
Prevention, sorry, secondary prevention. Okay. Wow. So there are prevention, different stages are there depending on at what stage or the person is, feeling
Correct.
that
So-
she is
That's right.
engaged in
So
this
secondary
particular
prevention is when already the virus is there, but we are
virus is
trying to
there.
pick up the abnormal cells that the virus might cause. Whereas primary prevention, which I would like to talk about now, Rajiv, with your
Please,
permission, is that
please go
okay?
ahead.
So primary prevention is where you're preventing the virus itself from taking, from causing trouble.
Oh,
So this human papilloma virus, it has many, many different subtypes. Many, almost about 81, I think 81 subtypes, of which not all of them are cancer causing, luckily. There are only few which cause cancer, out of which 16 and 18, HPV 16 and 18, are the most, about 70% cancers are caused by HPV 16 and 18. And those are called high risk HPV types. So if
okay.
we pick up the high-risk HPV types also during the pap smear, we can screen this lady more frequently, right? So that's why nowadays we do co-testing, where we do a pap smear for the cells, but we also combine it with a HPV test so that we know whether this lady is already having HPV or not having HPV. For example, if a lady is negative for cells, cells are looking normal, and HPV is negative, she needs a pap smear after 5 years, right? So that's a good news for her. Now coming to primary prevention, because this HPV has so many subtypes, of which only about 9 subtypes cause cancer, of which 2 subtypes cause 70% cancer, 16 and 18. So there's a wonderful prevention by vaccination. So I really would like to, for all the viewers to understand that HPV vaccination is very easily available now. And it's been available for many years in the UK and US. Even in India, it's very easily available. And the government of India has luckily taken an initiative under Modi ji's governance that it will become a government program as well. So it'll become a prevention strategy by the government. It'll roll out HPV vaccination to all young girls from 9 to 14 years of age. Now we're
Wow.
giving it as private practitioners. We give it from 9 to 14 years of age. And that is when the prevention or the protection is very, very high. 90% protection against cervical cancer if a girl has 2 shots of this HPV vaccination between 9 and 14 years of age at 0 dose and then 6 months later. So this gives 90% protection against cervical cancer. So I don't think there should be any doubt in any of the parents' minds that this HPV vaccination must be given to their girls.
So
So that's
the one,
primary.
so one question comes out of that is 9 and 14, very young age. So is it safe to get that vaccination?
Yeah. So, yes, I mean, it has been well researched. There are quite a few companies which have brought out the vaccine, but it has been well researched all these years, right? Now, having said that, every, scientific advancement will have something new coming up after 10 years, 20 years, etc., right?
Yeah.
So, for example, COVID vaccine, there were so many question marks about it. And we don't know whether COVID vaccine has caused all those sudden cardiac deaths. There's always this let's say, a big debate going on as to whether it's safe, whether those are, those unpredictable cardiac events are happening because of COVID vaccine or not. Is it thrombosis, etc., etc. But having said that, HPV vaccination is very well studied over a long period of time, and so far it's been proven to be safe and effective. So we will have to wait and see what happens 10 years down the line. But I myself have sort of taken it and I've given it to my boys. Now, having come to that point, why boys? Why only? Why
Yes.
is it only girls? Um, Now, the HPV vaccine, as I established earlier, is a sexually transmitted infection. So obviously, girls and boys are vulnerable to the HPV virus. So the interesting part of it is the boys can easily contract HPV virus as compared to girls. So the boys are more vulnerable to HPV virus. So if that's the case, HPV virus causes penile cancer in boys.
Oh,
So, and vulval wart penile cancer. So, it's important to vaccinate boys as well. So, the WHO and the CDC say that yes, you can vaccinate with the same vaccination at 0 and 6 months for boys from 10 to 15 years of age. Girls 9
Wow.
to 14 and boys 10 to 15 years of age. So I was saying that I have vaccinated both my boys with the HPV vaccination. So that's what I would like to say
So
on a
there is
personal.
no like side effects as such.
No, I mean, no, just maybe a little bit of pain from the injection. But even like a flu vaccine can give you a bit of body ache and
Correct.
fever,
Yes.
whereas HPV vaccination doesn't even give that. It doesn't even give that.
Oh, that's very interesting thing you brought up, and the prevention thing, the primary prevention again, going back to that, right? So basically, what you are suggesting is it's better to give early, age vaccination for the boys as well as the girls, so that this can be prevented at an early age, and that's very very good point, Arunaji, that you have brought. So now, since government has this vaccination free for the young girls, um, is the implementation has already begun?
I don't think so. I mean, I haven't heard of any implementation. I think they're going to roll it out next year, if I'm not mistaken. I
Okay.
haven't really read that news report. I've just, got the information from other sources. I have to actually read the actual report from the government. But I think they're going to roll it out next year, is what I understand.
So now, likewise in other cancer, you have different stages. So the cervical also has different stages.
Yes, absolutely. But again, the beauty of it is even before the stage one happens,
Hmm.
precancerous cells can be picked up. So this
Oh.
is called CIN1, CIN2, CIN3, where it's not cancer yet. We know that CIN3 can become cancer soon. So at CIN1, CIN2 level itself, we can identify the precancerous cells and deal with it.
Wow.
Then comes stage one, stage two, stage three, stage four. And stage one essentially is where the cancer is limited to the neck of the womb. So if that's the womb, the neck of the womb, it's just limited to the neck of the womb or the uterus. Stage two is when it's sort of spread outwards to the vagina. Stage three is when it's spread to the, pelvic side. And stage four, when it's already metastasized and spread to the other parts of the body. So again, each stage has its own, sort of descending order of survival.
Hmm.
As I said earlier, if it's picked up in the stage one, it's almost 90 to 95% survival because we can immediately sort of either do surgery or, radiotherapy or chemotherapy and deal with it immediately. But
Start the
with,
remedy process,
yes,
kind of.
absolutely,
Okay.
absolutely.
चलिए इधर एक छोटा सा ब्रेक लेते हैं, देन वी विल कम बैक इन द नेक्स्ट सेगमेंट. देर आर फ्यू मोर interesting questions are there, and definitely keep tuned in and enjoy this beautiful song.
मेरे
समाते हैं, क्या गैर वहाँ अपनों तक के साए भी न आने पाते हैं, साए भी न आने पाते हैं। हमने आखिर क्या देख लिया, क्या बात है, क्यों हैरान है हम, एक दिल के दो अरमान हैं हम, ओ मेरे सनम, ओ मेरे सनम।
वेलकम बैक टू भारत अन्वेषण। अगर अभी अभी आपने लॉग इन किया है तो आपको बता दो, आज हमारे बीच डॉक्टर अरुणा मुरलीधर जो बेंगलोर से बिलोंग करती है हमारे साथ है। वी आर टॉकिंग अबाउट सर्वाइकल और सर्विकल कैंसर, उसका इफ़ेक्ट, अर्ली सिम्टम्स नहीं बोल सकता हूँ, थोड़ा सा लेट सिम्टम्स होते हैं, और उसका जो रेमेडीज़ जो होते हैं या प्रिवेंशन जो केयर है उसके बारे में बातचीत चल रही है। प्रिवेंशन नंबर 1, अर्लियर प्रिवेंशन, सेकेंडरी प्रिवेंशन, ऐसा। एंड देन ऑल्सो व्हाट आर द vaccination can be taken at the early age for the children. It can be boys or it can be girls. सर्वाइकल नॉर्मली गर्ल्स का बारे में बात होती है, बट बॉयज़ ऑल्सो कैन बी गिवन द वैक्सीनेशन बिकॉज दे आर इक्वली वल्नरेबल फॉर दिस काइंड ऑफ डिसीज़. सो बिकॉज दिस इज़ अ ट्रांसमिटिंग डिसीज़ जो सेल से ट्रांसमिट होता है, सो दैट इज़ वाई दिस अर्ली प्रिवेंशन केयर जो है दिस इज़ एक्सट्रीमली इम्पॉर्टेंट. सो डॉक्टर अरुणा जी जो है बेंगलोर में क्लाउड 9 हॉस्पिटल में काम करती है. शी इज़ अ gynecologist, शी इज़ अ वेरी फेमस डॉक्टर इन बैंगलोर. वेलकम बैक अरुणा जी with this beautiful break again. And you mentioned about the risk factor, you mentioned about how a person can be taken care in the initial stage with the prevention methodology. And then also you said about the different stages of cervical or cervical cancer that is existing, and the government of India is trying to give this cancer vaccination for the young girls, and that is getting implemented pretty soon. And you also mentioned there can be little, actually no side effects as far as these vaccinations are concerned. Those are beautiful and very good information. So coming back to the cervical or cervical cancer, once the patient is goes through this particular remedies or the curing factors, can that person have a baby later on?
A very good question, Rajiv ji. Yes. So, cervical cancer is the cancer of the cervix, which is the neck of the womb. And a baby obviously is in the womb. So, it's a very relevant question to ask कि अगर cervical cancer हो गया और उसका treatment भी हो गया, तो can this mother actually bear children? So, luckily, because as I said, cervical cancer, if it's picked up in a very early stage or even the precancerous stage, we can just do a local surgery. We don't have to remove the uterus. We can just do a very localized surgery where we just remove the part of the area, I mean the cervix, which is affected by the cancer. So we have something called radical trachelectomy. We have something called large loop excision. All these are medical terminologies. But what we are trying to do is identify where the cancer is and just try to remove that area. So if we remove that area, then this lady can definitely conserve her fertility and go on to have a child later on. Yes, it may require cesarean section because the natural passage of the uterus may be scarred because of surgery. But other than that, the actual bearing of the child and going on till 9 months, with full sort of fully developed child with a full-term baby shouldn't be a problem. So luckily, yes, for cervical cancer, there are fertility conserving methods if picked up early. But it's already in stage 2, stage 3, stage 4. Definitely, it's not advisable because a mother's life, I mean, the woman's life becomes more important. So we may have to get into the uterus and subject her to radiotherapy or chemotherapy as is warranted. So yeah.
So that's a very good point you brought in, that yeah, a woman can have a baby, but will it have any side effect on the baby because the mother is survival of cervical cancer?
So if the cancer is completely removed, obviously whatever is removed from the body is sent for a biopsy, and the oncologist and the pathologist will have a look at the biopsy to see if the cancer is completely removed. So if the cancer is completely removed and she doesn't need any further radiotherapy or chemotherapy, certainly she can have a healthy baby without any implications on the baby's development, because she's not on any medications as such, and already the cancer cells have been removed. But having said that, if there is some cells lurking in the lymph nodes or something like that, then immediately after having a baby she should undergo the rest of the cancer treatment. That's very, very important. So it's a very fine judgment by the oncologist, obstetrician, and the couple as to what it means to her and her future fertility, the actual treatment. So it requires a
Okay.
lot of counseling, a lot of discussions and pros and cons and all that.
Yeah, that's right. Yeah. So in India, like how many like facilities are there now to cure this kind of disease?
Facilities for prevention are many, because every single hospital will have pap smears. Every diagnostic lab has pap smear. In fact, they do pap smears even if it's required or not. So, yeah, pap smears are available everywhere. And good pathologists are available everywhere. So they can definitely pick up abnormal cells and alert the gynecologist about it. But in terms of curing, or in terms of oncology centers or cancer centers where they can treat cancer, they are still far and wide. Very if you and the, as essentially an oncology center is a multidisciplinary, comprehensive center where they should have
Okay.
everything under one roof. Um, Doing hodgepodge treatment in cancer doesn't work. Like
Yeah.
one place diagnosis हुआ, फिर कहीं और थोड़ा सा ट्रीटमेंट हुआ, फिर तीसरे जगह गए वहां पे थोड़ा ट्रीटमेंट हुआ. ऐसे करने से it becomes a very hodgepodge thing, and her risk of obviously getting rid of the cancer, I mean, her chances of getting rid of the cancer will come down. It's always better to do it in a comprehensive oncology center where the diagnosis, the treatment, the chemo, the radio, the counseling, the dietitian, the sonologist, everybody is available under one roof. So those kind of oncology centers are few. Luckily, in
Hmm.
Bangalore, we are blessed with um, quite a few. I think nearly 6 or 7, or even more, even 10 to 12 oncology centers, which are fully fledged, which are
Ah.
comprehensive. So, but tier 2 cities, tier 3 towns and cities, they do not have these facilities. So, unfortunately, um, thoda sa treatment ho jata hai. That treatment may not be the complete treatment. Then, unfortunately, the first treatment is always the best treatment. So, जब भी वो first treatment होता है, पहला वाला जो treatment होता है, पहला वाला जो पहली वाली जो surgery होती है, that has to be पक्का. It has to
Hmm.
get rid of most of the cancer cells. अगर वो थोड़ा सा suboptimal हो गया, then the rest of the treatment becomes very cumbersome and
Challenging.
less
Yeah.
less
So,
effective.
so after this, let's say that if the earlier, let's say that the curing ठीक से मतलब उसको क्यूर नहीं किया गया, और the patient comes at a little later stage, so will that disease spread into other organs in the body, or how?
Yes, absolutely. That's the risk. That's the problem. Because
Hmm.
what is cancer at the end of the day? It is how, some cells, suddenly the body loses control on those cells. And the cells
Hmm.
have developed their own mind and their own, way of division. So those are cancer cells which are very multiplying very fast
Hmm.
without any control by the body. And they are, because they're uncontrolled growth, they get into the blood vessels, they get into the nerves, they get into the muscle, they get into all the adjacent parts, they get into the lymph. From the lymph, they get into the lymph nodes. Here, every cancer has a way of spreading. For example, cervical cancer spreads more into blood and bone and all that. Some cancers spread into the lungs directly. So every cancer has a way, or rather a chain of organs that it affects. So it is very important to understand कि थोड़ा सा भी cells अगर रह जाए, then they can cause havoc. So that is why even after surgery, many women have to undergo radiotherapy to get all the cancer cells killed. So radiation से
Wow.
पूरे वो जो बाकी बच गए हैं cells, उनको भी मारना पड़ता है जो रेडियोथेरेपी से एंड कीमोथेरेपी से और एडजुवेंट थेरेपी से और वो सेल्स को टारगेट करना पड़ता है. सो इट इज वेरी इंपॉर्टेंट अंडरस्टैंड कि कैंसर में जो फर्स्ट सर्जरी होती है, जो फर्स्ट ट्रीटमेंट होती है, वो very important just decision to be taken by the tumor board. So there's something called tumor board, which is a set of people which includes pathologists, radiologists, oncologists, and all the and obstetrician, gynecologist, to discuss this lady, her background, her age, whether she's had children or not, whether she's had any other health problems like diabetes or any, whatever, hypertension, and what drugs is she on, what is the ultimate pathology, the diagnosis, what stage is she, what would be the best way of treating her. So this is always a tumor board decision. इसलिए cancer treatment में it is not a one-man show. It is always a team management. And that is why it is important that कैंसर को ठीक तरह से ठीक सेंटर में ट्रीट करें.
Okay, excellent. Excellent information, Runaji. And then once the somebody gets treated and brought back to, let's say, a normal stage, right? So will that person has to have a continuous medication for the rest of the life, or?
For cervical cancer, there is no medication as such. In the sense,
Okay.
once it's cleared, she will need regular checks. Like the gynecologist has to, the oncologist has to see her, do walt smears, what we call pap smears, but the rest of the remaining part, whatever has been removed is gone, but the remaining part we still have to check the cells. We have to do an examination. We have to subject her to a PET scan, what is a positive, emission test. That is important to subject her to, in order to pick up whether there is any residual disease, any recurrence.
Okay.
Either residual disease or recurrence. तो इनको follow up करना पड़ता है. But in cervical cancer, there's no long-term medication as such. Whereas for breast cancer, there is long-term, there may be long-term medication. So for cervical cancer, there's no long-term medication. It is mainly long-term follow-up. So they need to be followed up for up to 5 to 10 years to make sure there is no residual disease which is causing trouble, or there is no recurrence, which is, again, new cells forming, new cancer cells forming. So this is important for follow-up also.
Okay. So, and having said that, does the patient has to have special diets or anything?
Yes. Again, it all boils down to, I think cancer survivors are the best people to understand how important lifestyle is.
Yeah.
So there are a lot of programs for cancer survivors, and they are the best people to tell as to what works best. So again, it boils down to lifestyle. They definitely will have to stop smoking if they've been smokers before, and build up their immunity by being what we call, at the best lifestyle possible, optimum lifestyle.
Sure.
So when I say lifestyle, I just talk about eat, move, sleep. Eating right at the right times, moving right, which is exercising right at the right times, and sleeping right. So which is, 7 to 8 hours of good sleep and getting rid of stress. And this is what it is: eat, move, sleep, breathe. अगर ये चार ठीक तरह से कर लें तो जिंदगी हमारी आराम से बीत जाएगी.
Yeah, that is true. But we are human beings. They don't follow that strictly, right? So the diet definitely is very important. Eat healthy food, and then definitely rest is important for the body. That way your mind gets, it is always in proper peaceful condition. And then, as you said, move, which is definitely walking or some exercise. So that's very important. And I think these are the very important factors after, if somebody survives these kind of deadly diseases.
Even to prevent.
Yes.
So we
Yeah.
don't know what is increasing cancer. Luckily, cervical cancer was the topmost cancer affecting women until very recently. But now
Correct.
the incidence is coming down. One is because more awareness and more hygiene, improved hygiene and more sort of screening. Breast cancer is unfortunately taking over.
You're
Breast
taking
cancer is
over.
increasing a lot. Yes.
Yeah,
So
it is.
luckily, cervical cancer is coming down. So in general, for any cancer, I think it's important to follow a good lifestyle, avoid smoking, alcohol, and making sure you're getting a good sleep, avoiding stress, avoiding environmental pollutants as much as possible, avoiding
Hmm.
microplastics. Plastics तो हर जगह हैं, pesticides हैं, in adulteration है. So we don't know what is messing up with our systems. Some of them are unavoidable, some of them are avoidable. So whatever can be avoided, I think we should try and avoid with a good
Very
life.
rightly said. Very well said, Dr. Aruna. So we are almost now coming to the end of the session, Aruna जी. एंड दर्शकों को बताऊं, आज हमारे बीच जो है डॉक्टर अरुणा मुरलीधर, जो गायनेकोलॉजिस्ट एक्सपर्ट है, जो बेंगलोर में क्लाउड 9 हॉस्पिटल में शी वर्क्स. एंड यू कैन लुक अपॉन एनी सोशल मीडिया, फेसबुक देख सकते हैं या इंस्टा. Definitely you can check on Dr. Aruna Muralidhar and she is there, and you can know more about her on the social media. अगर और भी आपको information चाहिए, please get in touch with me. I will definitely help you to get. अरुणा जी, एक पूछना था about your book 9 months वाला. So can
Sure.
you just throw some light on that
Certainly.
before
I mean,
we...
I'm very proud to have become an author in 2023. So last May on Mother's Day, I had God's blessings to release the book called 9 Months, The Journey of a Lifetime, because it's a journey of a lifetime for both the baby inside and for the mother also.
Absolutely true.
So,
Yes.
and it's a comprehensive book, very entertaining and informative. It's available on Amazon. It covers from pre-conception, conception कैसे होती है, fertilization कैसे होती है, till delivery and beyond, and breastfeeding, and
Wow.
Ayurveda क्या कहती है pregnancy के बारे में. So it's a very well researched and simple terms, not a medical book. So anybody, any family member or any pregnant lady or her husband or in-laws or mothers, they can read the book and understand the marvel of pregnancy, because it's such a beautiful process that happens in a woman's body, and
How
so
how can
beautiful
they
process.
reach out to that book? How can they...
The book is available on Amazon, Flipkart, and
Okay.
even with the publishers, Prism Publishers. It's available both in the Kindle format and the
The
regular format,
normal...
the book
okay,
format.
great. Great,
Yeah,
great.
in the US, it's available in Kindle format. I
Okay.
think it's not available as a book, but in India, it's available as a book as well. So,
Okay, great, great. That's a good information which can be, shared with a lot of people. Excellent, Aruna ji, and you gave us a lot of information about today's cervical and cervical cancer. And I'm pretty sure darshakon ko definitely, if they were busy for whatever reason, today is a holy Dahan day, which is being celebrated everywhere in the world by Indians. And naturally people are engaged in lighting up some bonfire
bonfire.
and yeah,
Yes.
bonfire and things like that. So they must be busy, but the best part of YouTube channel is they can watch this show anytime and anywhere whenever they find some time. And definitely there's a lot of very good information, I would say, that you provided. And thank you again so very much for sharing your valuable time, Aruna ji. And it's always a pleasure to have a chat with you, have a nice live show with you. And because of wealth of knowledge you have in your field, and which definitely our audience would cherish and enjoy that in the coming days for sure. थैंक यू वंस अगेन. एंड दर्शकों को भी मैं बहुत बहुत धन्यवाद बोलना चाहता हूँ. एंड डेफिनेटली संदीप को भी. संदीप, थैंक यू सो वेरी मच फॉर supporting with your technical expertise. Next Sunday, you are going to watch on Bharat Anveshan the repeat program of the chief architect of Ram Mandir, who has which was actually inaugurated in the month of January. That is Mr. Sompura के बारे में जो इंटरव्यू हमने किया था जनवरी में, वही इंटरव्यू हम रिपीट करने जा रहे हैं नेक्स्ट संडे, बिकॉज I will not be available on a live show. I will be in India for some different reason. So, but we are repeating the same, which was actually live show in the month of January. So don't forget to tune in. But till then, wherever you are, अपना ध्यान रखिए, तंदुरुस्त रहिए और खुश रहिए। यही बोलते हुए आपका दोस्त, आपका होस्ट राजीव कुलकर्णी और एक भारत अन्वेषण का कार्यक्रम का एपिसोड का साइन ऑफ करता हूँ। नमस्कार।
Namaste.